The U.S. is the only industrialized nation where maternal health outcomes are in decline. And for Black women, the disparity is even greater. According to the Centers for Disease Control and Prevention, Black women in the United States are 3 times more likely to die from a pregnancy-related cause than white women. But a group in New Jersey is determined to make it safer for Black women to have a healthy pregnancy. Joining me now is Dr. Nastasia Harris. She is a registered nurse and the executive director of the Perinatal Health Equity Initiative. Good morning, Dr. Harris.
Good morning, Mary. Thank you so much for having me.
Oh, glad you're with us. And let's talk about the reasons for these health inequities. Why are Black women more likely to have complications during pregnancy and childbirth?
Sure. So it's actually not that Black women are more likely to have complications, but it's more likely that we're not listened to and heard when we express that we're having some concerns during our pregnancy. And so that results in a lot of these preventable deaths. So for example, in New Jersey, a Black woman is 7 to 8 times more likely to die from a pregnancy-related complication, which is higher than the national average. It was found that Black women were actually 90% more likely to have preventable complications. So what that tells us is that there's nothing genetically different about Black women that makes us more likely to have these risks, but it's the factors that surround us, most likely racism and implicit bias.
This week, your organization is hosting the first NJ Birth Equity Conference. What are you hoping to achieve?
Yes, we are super excited about that event. It is actually this week, May 19th through the 21st at the Robert Treat Hotel in Newark. We created the space to really amplify Black-led models of care. As you mentioned in your opening, that Black women are more likely to be impacted by these maternal health outcomes, but we're not leading that work. And so we wanted to create a space where we are honoring the wisdom and work of our community, our scholars, our researchers, our community workers, so that people can learn from the work that is being done in our communities, and we're not seeking to replicate models of care that are actually really working well in other places.
And May is Preeclampsia Awareness Month. What do women need to know about this serious complication?
Sure. So I want to start by just defining what preeclampsia is. Most people think about elevated blood pressure when they hear preeclampsia, and that's a component, but it really is a multi-system type of condition. So it can impact your kidneys and your liver. And so it's very important for women to understand this myth that it can actually happen at any time during pregnancy. So not just during your pregnancy, but the immediate period after birth, as well as in the postpartum period. So it's super important that Black women know what the symptoms are, so they can get them addressed immediately. So things like a non-remitting headache, which is a headache that doesn't respond to treatment, having increased weight gain, swelling in the face and the hands. These are things that are very easily dismissed as normal pregnancy complaints, but they can actually be very ominous warning signs. One of the programs we have at Perinatal Health Equity Initiative is the administration of blood pressure cuffs to every pregnant woman that comes in our office. And that's very important for people to know their baseline so that if there are some changes, they can easily identify them and bring them to the attention of their doctor. Other thing I want to mention for Black women, as you're entering prenatal care, ask your provider about your risk so that prevention measures can be put into place early on. And then lastly, a really critical component, preeclampsia has a significant impact on the heart. So it can cause complications like cardiomyopathy. And one of our big pushes is to make sure that anyone that has that diagnosis also sees a cardiologist, not just in the immediate period after birth, but for several years forward because of the risk for cardiovascular disease.
Dr. Nastasia Harris, Executive Director of the Perinatal Health Equity Initiative. Thank you so much for being with us.
Thank you.